So as I've stated, that elective abortions should be allowed because of restrictive loss, poverty, and limited education on pregnancy, not just based off of women's health or fetal abnormality. Elective abortions are built around restrictions to help avoid issues and controversy, which is why they should continue. Women seeking late-term abortions are not given the easy access to it, as there are rulings that would help prevent late abortions for uncompelling reasons. In Virginia, Democratic Delegate Kathy Tran introduced a bill with the backing of her party and of Democratic Governor Ralph Northam that would significantly loosen existing restrictions on abortion in the final 3 months of pregnancy. Currently, third trimester abortions are permitted only if 3 doctors certify that a woman's health otherwise would be substantially impaired. And the laws for abortions are flawed in terms for fetal pain. If we as a society believed we should not be doing procedures that may cause pain, the argument used by proponents of fetal pain legislation, all invasive procedures and surgeries would be banned. It would rather appear that all widely recognized ethical obligation is to limit pain to the best of our abilities, not to ban anything that may be painful. Allowing a non-medical third party, the government, to dictate the counseling and treatment be based on sources other than evidence, clinical judgment, and the patient's wishes undermines the scientific accuracy and patient-centeredness of the counseling process. If the laws are to justify the concern for fetal pain, abortions after the first trimester have fetal analgesia available to prevent any pain considered to the unborn fetus. If the goal as the most invasive medical intervention is to prevent or limit possible pain, rather than prevent terminations, a more robust and defendable position would be to require fetal analgesia during terminations after the gestational age at which scientific evidence suggests the fetus has developed the ability to feel pain, for example, mandated general anesthesia during fetal surgery and vaginal deliveries. And in the cases of unknown pregnancy and the correlation to late-term abortions, they are quite rare. 1 out of 7,225 pregnancies is unknown to the mother until delivery. And most women don't realize they're pregnant because if the placenta is not on the front part of the uterus, people don't feel baby's movement that much. And there's also in terms of irregular menstruation cycle, and only 70% of women experience morning sickness. And with not knowing you're pregnant, you don't get the medical care you need, and it can cause further health issues for the baby and the mother. And women in hesitant or tough situations may decide to abort later and seek help at health services, because women in violent relationships often face difficulties in thinking about the pregnancy. Some may be overwhelmed by the complexity of issues they have to grapple with. Not only are they living with a violent partner, but they are under a time constraint during their thought process about pregnancy outcome and abortion. And younger women or adolescents are immature to fully understand their options at the early stage of pregnancy. Among women under age 15, 1 in 5 abortions is performed after 13 weeks gestation. 12% of teens aged 15 and 19 obtain an abortion after 13 weeks gestation. Common reasons why adolescents delay abortion until after the first trimester include fear of parents' reaction, denial of pregnancy, and prolonged fantasies that having a baby will result in a stable relationship with their partners.